A bill moving through the Michigan House of Representatives could affect cancer patients' ability to afford certain chemotherapy treatments. 13 on your side's Josh Albertus joins us now with more on what this bill could do. Hi, Josh.
Hi, Elena. This bill seeks to ensure a patient would be able to have the same financial access to oral chemotherapy as opposed to other more traditional chemo methods, should they and their doctors determine an oral form is better for them. Lawmakers and cancer treatment advocates rallying in Lansing this session to push through legislation on oral chemotherapy over a decade in the making.
We've been working on this bill for over 15 years. It's not just a piece of legislation that is moving through the process. It could be life-saving. It could be life-changing.
House Bill 4071 would look to balance access by having private insurance companies limit copays on oral anti-cancer medication or make financial requirements equal to other forms covered by a policy.
I think we've come to a good spot in the bill where we're at now, that basically if a insurance plan covers chemotherapy or cancer treatment, that they need to treat the oral drugs the same as they would treat the IV drugs, the intravenous drugs.
At the American Cancer Society's Cancer Action Network, Michigan Government Relations Director Molly Medenblik said the bill would remove potentially harmful complications.
There's going to be over 61,000 people in the state of Michigan that are going to hear those words, "You have cancer," this year. If a doctor does say, "We want to prescribe you oral chemo, we think that's the best course of action," then you're not worried about looking at your insurance company, "Okay, can you cover this or do you cover that?" That's just one complication that we would like to remove from this equation.
In Michigan, one of only a handful of states without these guarantees, cancer therapy advocates say options can often be limited.
Oftentimes, oral chemotherapy costs are outrageously more expensive. Somebody could be spending $3, $4, $10,000, or some of the numbers I've heard from patients, out of pocket for oral chemo, which that makes it so out of range for many people to be able to afford that.
A three-time cancer survivor herself, Heather Hall said she knows all too well the exhaustion that comes with chemotherapy treatment. It's why she sees it as vital to make options like oral medication more accessible.
It's hard enough when you hear the words "it's cancer," but if you can have something to be able to help you stay at home, maintain your normal life, that's priceless. There's no price tag you can put on something like that.
Now, the bill is still waiting for a hearing in the House Health Policy Committee, but Medenblik said she is hopeful a hearing date will take place this month. Elena.